All right. Well, we just heard a little bit about some concepts with exercise, such as target heart rate. And Connie, do you know about target heart rate?
I know very little about that.
When you exercise, how do you measure how successful you are at your exercise, or whether your exercise is doing the job it should be?
Usually I go by time on the treadmill or the elliptical and by how high I have set, like,
Your
the
intensity.
incline and the intensity.
I think the problem people have, if you want to get scientific about it, is they don't understand how to make sure they're getting out of their workout what they should be. So I hear people, I say, when I see my patients, do you exercise? And everybody says, yes, I exercise. What are you doing? Well, I'm walking. Walking is not truly exercise. Yes, it's good for you. But if you really want to get to what we call a fat burning zone, where you're actually burning fat, you need to be working your body out at a certain intensity. Now, people think when they work out, you're building your heart muscle, and that's what heart rate is measuring.
Right.
Heart rate has nothing to do with the muscle of your heart. It has to do with how your body, how hard your body's working out, how it's utilizing oxygen, and how it's working to build muscle. And a lot of people in the sports community have really, really adopted this. So for instance, Lance Armstrong knows exactly how hard he's working by looking at his heart rate, and he knows at what heart rate he needs to be in order to improve his performance. Well, we're now taking these concepts from sports medicine and applying it to our patients. It's hard for me to tell someone work out hard because no one knows exactly
Right.
what it is. We used to use what's called RPE, or rate of perceived exertion, and that is, you should work out where you're out of breath and you can't carry on a conversation, but even that's hard to measure. So rate of perceived exertion has that word perceived in it, which could
Right.
vary. So we're starting to go to heart rate. Now, to truly know what heart rate to work at, you really need to get a test done where you breathe in a machine and they measure you as you work out harder, and they can tell when your body starts going into lactic acid threshold and when your body's overworking. And from that, they can extrapolate what your heart rate should be to burn fat, what your heart rate should be to improve cardiac performance. So for instance, Lance Armstrong wants to work out at a certain heart rate so that he does better at high intensities. But our patients want to work out at what's called a fat burning zone. And we can calculate that. And once we've calculated a fat burning zone, then when you go to the gym and you wear a heart rate monitor,
Right.
you could be sure that you were in the fat burning zone, so you were making worthwhile of your 30 minutes of working out and your dollar spent at the gym. So what the target heart rate gives us is a way for me not only to specify what exercise for you to do, but to make sure that you do that exercise so that you get the most benefit.
So how do I know when I'm there at home, and how long do I stay in that mode?
Right. So what the studies have shown, now the best way is to actually get a test done where you're breathing in a machine and it's measured your CO2 output in determining your metabolism during the procedure. But the easiest way to do it is a formula, which I don't think works that accurately, but it's better than nothing.
Okay.
And that formula says that 220 minus your age
Okay.
is your target heart rate. No, I'm sorry, is your maximum heart rate.
Okay.
220 minus your age that's your maximum heart rate. All right. So for instance, I'm 40 years old. My maximum heart rate is 180. For me to be in a fat burning zone, I need to be about 70% of that.
Okay.
All right, at 70% of that 180. So I really, for my fat burning zone, that's 140s to 150s. So when I'm just trying to, lose weight and have a good workout, but not an extremely hard workout,
Right.
that's what I do. When I'm training for a competition, since I do triathlons,
Mhm.
I want to increase to getting close to my lactic acid threshold, so I can learn to get faster when things are getting tough. Then I'll go up to the 160s in my heart rate. But I could, set my heart rate for what my goals are.
So if I'm trying to lose weight, do I want to stay in that zone
You want to
for a longer period of time than if I'm trying to maintain my weight?
Actually, the interesting thing that's come out in the literature is that 30 minutes of working out 5 days a week is all you really need. Now that study did not actually go into target heart rate zones, and are people doing enough for that 30 minutes? But you got to think, if 30 minutes is all you need, and people probably weren't using target heart rate,
Right.
if they used their target heart rate zone for that 30 minutes, then they would definitely get what they needed. So I would say 30 minutes 5 days a week would be a good prescription to start.
To lose or to maintain?
To lose,
Okay.
to get into that fat burning zone.
Okay. Thanks.
Sure.
So in summary, the definition of target heart rate is?
Well, the definition of target heart rate is I'm speaking English. So the definition of target heart rate is a heart rate that shows you that your body is actually burning fat at that time.
Or the formula.
Oh, the formula for target heart rate, it really depends on what your goal is, but 220 minus your age is the maximum heart rate you should get to.
Okay.
And if you're going to get a target heart rate where you just want to burn fat, I would say that would be 60 to 70% of that maximum heart rate.